Wouldn't it be nice if you were able to keep your clients longer and increase their stay by 30%? Wouldn't it be nice if you didn't have clients jumping off because their insurance ran out? And wouldn't it be nice if you had easy and effective ways to check on clients' progress?
Wouldn't it be nice if you had good feedback from clients to make adjustments to meet their needs? Wouldn't it be nice if you had the most advanced client services?
If you are ready for your practice to be more profitable, more efficient, and to have more effective delivery of client services, stay tuned. We have a lot to share with you. Hi, I'm Lynn Wilroy, founder of the Holistic Mental Health Clinic. I've been in the mental health field for 19 years. I've been in private practice for 13 years. My practice is all cash pay, and 4 years ago, my practice brought in annual revenue of about $130,000. Last year, using the procedures we're about to show you, we brought in $330,000. Let me introduce my business partner, George. George joined the team 2 years ago. He is my technical and financial consultant.
Hello, I'm George Nelson. I'm Lynn's technical consultant and financial helper. Thanks for the great introduction. I have been in the business for over 30 years. I have experience as an instructional designer and learning architect. Much of this time was involved in designing, developing, and delivering e-learning applications.
Our first promise. This is a training session, not a come-on session. This is information you won't see anywhere else. And the procedures that we are about to show you are state-of-the-art for the delivery of mental health care services. These procedures are designed to help you take your practice to the next level and put more money in your pocket.
Our second promise. As a result of attending this webinar, your client's satisfaction will improve. Your clients will lengthen their engagement with your services, and you'll get more new patients with the use of these procedures. Plus, you're going to enjoy your practice much more.
Our third promise. You don't have to be a technology wizard to use our procedures. We have made it very simple. And as a matter of fact, if you can use the internet, you can use these easy procedures.
Our first premise. All therapists in private practice want to provide the best services possible for their clients.
Our second premise. All therapists need assistance to organize the delivery of their services. Therefore, the idea of a set of procedures or methodology for your practice.
Our fourth promise. This informational webinar will over-deliver.
And now your promise to us. If we do a great job of giving you the best information you've ever heard regarding improving your services, getting more clients, and increasing your practice revenue, you'll give us 10 minutes at the end to show you how to get even more assurance for success in your practice.
Now, the objective of this webinar is for you to understand how to keep clients for their full course of treatment, to provide better case management, and to increase your revenue.
Let me share how I got here. I've been successfully working in private practice for 8 years, but it wasn't always this way. My practice started from the worst personal disaster of my life. I found myself struggling as a single mother, trying to support 2 children on my own. I was in agency work, and it just wasn't paying enough, so I started seeing clients on my days off and in the evenings. I worked 2 jobs, 6 days a week, for 4 years to make ends meet for my family. This was a trying time, physically, mentally, and emotionally. Yet gradually, things began to improve, and I was finally able to leave one of my jobs. I'm grateful that I was able to leave the agency work behind. Now that I was able to focus my attention on my private practice, I began to study, learn, and implement the business of how to be successful. I was doing well, but managing my practice was becoming overwhelming. I was at my wit's end with client communications, paperwork, and keeping up with the high standards of client services that was the foundation of my practice success. Then I stumbled on a plan that soon became a set of procedures or methodology to the delivery of client services that brought my revenue from $130,000 to $330,000 a year in just 4 years. Now, I know my limitations, and I knew I was going to need expertise to fully develop and implement the plan. I got with George and discussed the plan together, and we developed the plan into a set of easy-to-use methodologies for any practice. And as I've shared, the results have been spectacular. As I trained other therapists, they too were getting the same spectacular results. It was then that we realized this could help other therapists be more successful in practice and achieve the same results. We are sharing for the first time the exact procedures that I used to increase the efficiency of my caseload management. Just this week, I was able to go from 20 service hours a week to 30 service hours a week for the first time, and it was no problem.
Let's do the math on that. If you go an extra 10 hours in 1 week at a rate of $150 an hour, that's $1,500 extra for the week. Then if you take $1,500 and you multiply it by 50 weeks for the year, that's $75,000. Hey, multiply that by 5 years. That's over $375,000. That's a lot of extra money. What would you do with that extra money? How about more time for yourself and your family? Travel. Maybe take your family on a vacation. See the country. Go to Europe, the Caribbean. Support your church. Help with their missions. Pay off debt. Save for retirement. Remember, the objective of this webinar is for you to understand how to keep clients for their full course of treatment, provide better case management, and increase your revenue. Let's meet those objectives.
How to keep clients for their full course of treatment. Maybe you have heard about the plan of care before. If you haven't, you need to listen up now. The plan of care is essential to the success of your private practice, even if you accept insurance. Practices that use the plan of care increase their clients' visits by 30%. The plan of care is presented to the client on the second visit. The plan of care is where the therapist presents to the client an understanding of the client's condition, goals for treatment, and how to measure their goals. This is also where the therapist provides the estimated number of hours of treatment recommended for the client to reach their goals. By the way, for attending today, we are giving you a copy of the plan of care. Just stay to the end and you'll have a download option. Now, there are 3 parts to the plan of care. Part 1 is the team building exercise between the therapist and the client. This is where the client's situation, condition, goals, measures, and any unique circumstances are identified. Part 2 is where the therapist provides the estimated number of hours of treatment recommended for the client to achieve their goals. And Part 3 is where the block purchase option is offered. Let's take a look at Part 1. Okay, so Part 1 of the plan of care, you'll see it up on your screen. Part 1 is where we're going to just make a short synopsis of their situation or condition that they're presenting with. This is where you really want to hit on what the client has presented as their pain points, what's going on in their life, and any things from their past that may be influencing their situation today. The next section is where you're laying out the goals for treatment. This is where you've heard what the client has stated about their goals, and now you're filling in the goals for treatment: reduce depressive and anxiety symptoms, stabilize mood, decrease impulsivity, increase feelings of peace and calmness. Now the next section is measurements or measures. This is where you're going to get some measures that will help them be able to chart their progress in treatment. Things like a 0 to 10 scale for depression, 10 being the highest, anxiety. You could also go the other way for 0 to 10 self-esteem, 10 being self-esteem is good, 0 they're not feeling very confident or having much self-esteem. This is also where you can get things for like maybe if they're having anger problems, the intensity, frequency, and duration measures. And finally, there is the unique circumstances. This is where you'll put down any things that are unique to this client that are important to understand. For example, maybe they're a single mother, or maybe they have a very high pressure job and they travel a lot, or maybe they're going through a divorce. Those are the types of things you put in the unique circumstances. Remember, part 1 is a team building exercise between the therapist and the client. It both strengthens the therapeutic relationship and empowers the client. When I'm laying this out, I tell them that I'm going to need their support or their help to make sure that I've gotten everything clearly as it's presenting in their life. After presenting part 1, I've had clients so grateful and moved that someone has actually listened and understood them. Now, let's get on to part 2. Part 2 of the plan of care is, and as you'll see, we have different categories. And this is where you're going to list the different categories of the number of hours of service you think it's going to take in order for the client to achieve their goals. So you can see there's things like history taking, and then things like specialties. So if you do EMDR, clinical hypnotherapy, maybe EFT, you'll fill those in as well. Whatever the specialties that you may have are, you'll put there. Solution discussion, solution enactment. If you do any type of spiritual work, you can use spiritual strengthening. And I always put some in there for assessment. And then finally is the total hours of treatment you think it will take in order for the client to achieve the goals. Now look, clients know the challenges they're experiencing, and they know that they didn't just develop in the last few months. And to really move forward, it will take more than just a few sessions of treatment. I have had nothing but positive feedback from clients using the plan of care. I've written a plan of care for as few as 18 visits and as many as 48 visits. And clients don't bat an eye. They appreciate the honesty about the scope of work needed in order to achieve their goals. Now, let's move on to talking about the block payment option, part 3. In part 3 of the plan of care is where you're going to present out the total cost of the plan of care based on the number of hours of treatment recommended. And then you want to offer incentives for them to purchase blocks of service. So for a block of 10 hours, there's a 10% discount. A block of 20 hours, there's a 15% discount. And a block of 30 or more hours, they get a 20% discount. We have had clients consistently take advantage of the block purchase option. As a matter of fact, last week, I also collected 2 blocks of 10 and 1 block of 20 options for a total collection of $5,250 from just those 3 clients. Offering client block purchase options is a win-win. The client commits to their treatment and receives a discount, and you improve your revenue stream.
Again, remember our objective. It's free to understand how to keep your clients for their full course of treatment. And with that plan of care that Lynn just presented, you can certainly do that. We also want to provide better case management and increase your revenue. I think we've been successful so far, but I think we've really used the long method of getting there.
After many hours defining, redefining, and polishing our procedures, we asked ourselves some questions. Why don't we share our success with other practices? How do we share with others? And we knew we needed to make it simple. Remember the procedures for implementing the plan of care? We improve our case management and increase our revenue. Those procedures all work well, but they too can get cumbersome. Handwriting notes or using desktop publishing can get cumbersome and even hard to store. So, George and I got together and discussed many options. Then it hit us. We needed an application that would keep everything in one place. Information at our fingertips for ourselves, clients, and our therapist.
So we created MindPath. Now we've taken all our successful procedures and put them into MindPath for you so you can be even more successful in your private practice. This is not just another office management software. MindPath is not just another patient portal. MindPath is a patient partner for your practice. MindPath is fully interactive and it engages clients with the therapist. So the question is, why do you want to be the first to get in on this application for your practice? In 2008, when the Apple Store opened, there were 800 apps available for download. By 2017, there were over 2 million. 1 in 4 e-commerce dollars are spent on a mobile device. According to Statista, March 6, 2018, in an article titled, "Mobile e-commerce is up and poised for growth," it states, quote, "Worldwide e-commerce growth is primarily being driven by consumers using their mobile devices, their phones, and tablets to acquire goods and services." Another one, according to Think with Google, in an article titled, "Win Every Micro Moment with a Better Mobile Strategy," the article states that people check their phones 150 times a day.
That's crazy.
It is, it's crazy.
Times, but I believe it. Because everybody is always on their phone.
And on average, they spend around 3 hours on mobile apps. Furthermore, 70% of brands are adapting their business to the rise in mobile usage.
The mental health industry is already changing, and we have seen a rise in app usage like Talkspace. The MindPath app offers therapists and their clients so much more. Don't find yourself left outside of the e-commerce statistics. MindPath is compatible with all mobile devices, iPhone, Android, tablets, and desktop.
Wouldn't it be nice if you had a partner to help you manage your practice? Wouldn't it be nice if you could be more responsive to your clients' needs? Wouldn't it be nice if you could generate more money?
That would be awesome.
Wouldn't it be nice if your clients could pay for their services and manage their own appointments? Wouldn't it be great if your clients were automatically alerted to check their treatment progress?
That's the one I love so much, for them to just be able to check automatically, and then I get those numbers in.
Me too, I tell you. Wouldn't it be nice, though, if all this information we just talked about was instantly available to you?
And wouldn't it be nice if you knew in real time how your clients were feeling before the session? And that you had more secure messaging with your clients? And wouldn't it be nice if you could provide your clients with a recap of their session to keep them on track, and they could have a record so they could refer back to the work that you've done with them? And wouldn't it be nice if you could get client feedback immediately after each session? A little story on this one. I have a family member that I've been encouraging to go to therapy. And she finally went, so I excitedly called her and said, "Great, how's it going? Tell me how things are." And she said, "Well, okay, I guess. I've been about 3 times, but I really don't think she's helping me." And I said, well, what's going on? And she said, it's just she's not giving the kind of responsive feedback that I need for my situation. And it was disappointing, and that therapist is going to have someone drop off and not really be able to understand why. Yet if she had that feedback from my family member, she would be able to adjust her therapy and she would not have a drop off.
Feedback is important. I know it is for me. Anytime I ever take a test, I want to know right away, what's going on? How did I do? Our clients want to know how they're doing. Feedback sessions help. So MindPath is not another rendition of therapy notes. However, they complement each other. MindPath is a system of procedures designed by experts in the mental health field to keep your clients engaged. Let us introduce you to some of the key features of MindPath. This is the app welcome screen, and MindPath is downloaded from the App Store. And when it is, you start here, the welcome screen is displayed. Your choices here are client, therapist, and practice. And we're going to go through this. For this demonstration, you can see for the client, we're going to be the client. So we're going to click on the client button and see where that takes us. It takes us into the client welcome screen. And from here, the client can put their name, their email in. They can put their birthday in.
This is something I love because they're going to get automatic personalized birthday messages. Plus, you're going to get an alert when your client is having a birthday. So no more missed birthdays, and it's really going to put that personal touch on your care.
Anybody, how great is it to have your birthday remembered? Anybody ever get their birthday forgotten? Definitely don't want to do that with your clients. So this is awesome. They get an automatic personalized message. They can also get their phone number in here. They do their user ID and password. After all this is accomplished, we get into the client home screen.
Look at this beautiful client home screen. MindPath is appealing, interactive, intuitive, and informative. It's designed to engage your clients in your treatment. Imagine your clients being able to engage in your treatment using MindPath.
Well, if we take a look at the home screen and see what's here, at the top left of the home screen, they have a menu option. We'll talk a little bit more about what's in the menu later. Right to the right of that is the tour train. Now, the tour train is a little demo that they get to go through, and they're prompted once when you first download the app, and then you can go on the tour train anytime, but you'll see that pretty soon. The messenger option is on every screen. The client also has the profile. They've got the mood tracker. You can see the mood tracker down about a quarter of the way down on the screen. They've got the quote of the day right below that. The calendar.
And remember the plan of care? It is essential to the success of your private practice. And remember that private practices that use the plan of care increase their client visits by 30%. MindPath makes it easy to implement and use the plan of care. Now let's look at how MindPath makes the magic happen. You'll notice just below the calendar, you'll see the plan of care tracker. When the client clicks on this button, they can easily check the number of sessions they have completed compared to their plan of care. Now, we know how hard it can be to change the way you do things. That's why we created MindPath, because it makes it easy to implement and use the plan of care to grow your business by at least 30% from this one feature alone.
So let's take a look at how the plan of care leads into collecting more money, whether you're cash practice or you take insurance. Here's the block payment tracker. Remember earlier when Lynn was going over the plan of care, you had the block purchase option? Well, when clients click on the block payment tracker, and you can see it on the screen, they get to see the status of their block usage and make payments. We'll talk more about how MindPath makes collections easier very soon.
Remember, because you have presented to your client the best estimate of the total number of hours, they understand the scope of treatment and are far more likely to make the investment into their full course of treatment. And if you take insurance, the plan of care encourages your client to go cash pay and continue their treatment with you after their insurance runs out. No more auto drop-offs because your client's insurance is out. And they just assumed that that was enough care. So, whether your insurance client has converted to cash pay, or if your practice is cash pay, it is now simple to offer incentives for your client to make block purchases for your services and for you to make big collections. Now let's take a look at the block purchase screen.
You can see the block purchase screen. We've got it up there full screen for you. The block purchase option is offered when a client makes a payment. For example, there's the 10-hour block, and if there's a rate of $150 an hour, we got a 10% discount. That comes to $13.50. But you can also see there's a 20 block option, there's a 30 block option, and those discounts are in there as well. We talked about them earlier when Lynn was showing you the part 3 of the plan of care, but here they are in MindPath, and it certainly makes it easier for you. When a user clicks on any of the block purchase buttons, they are directed to the payment screen. This automatically figures the therapist's hourly rate, then shows the total price due at the discount. That's incredible. I mean, it saves you a lot of time, especially if you have 10 therapists and all those different rates. Sure saves a lot of time.
So let me tell you the story about collecting my first block. When I first started, I was only charging $65 an hour. I thought that since I wasn't taking insurance, I needed to keep my rates low. So also, in all honesty, I was just plain nervous about if I was worth it. And after early successes, I convinced myself to raise my rate. I was still quite nervous, so I only went to $95 an hour. But that still didn't feel like where I should be at, so I decided to raise my rate to $125 an hour. That was a big step for me. Now, shortly after that, using the plan of care, which is now a key feature in MindPath, I collected a block of 10 sessions. I could hardly believe it. And that was back when I was collecting my own payments. So when I turned to my desk where my credit card reader was, my hand was shaking as I collected a payment for over $1,100. Since then, I've collected multiple blocks of 10, 20, 30, and more. And you can too, with this key feature in MindPath. Now, it's time to talk about milestones. Milestones. Remember on the plan of care where we set those measures, those individualized, personalized measures for each client? How many of you, after setting an initial measure, have forgot to check your client's progress in a timely manner? I'll admit I have done that before. I think we're all challenged with this, and we should all be providing the progress checks. Now, with MindPath, we call them milestones. This is great. MindPath will automatically do this for you. This is a case management dream come true. Clients love having their treatment measures checked on schedule. The milestone button will automatically become active after every 8th visit. And then the button will stay grayed out once they've completed it. Clients can then receive an alert for them to check their milestones, and you will receive an alert when they've completed their milestone. You will be able to efficiently and effectively address clients' treatment progress. With MindPath, you will never miss checking a treatment measure on schedule ever again. Your clients will be more engaged with their treatment, resulting in improved client services, better client retention, and increased revenue for your practice.
We have just scratched the surface with all the incredible things that MindPath can do for you and your clients. It's time to take a ride on the tour train.
Welcome to the tour train for MindPath. What you are looking at now is the welcome screen. Whether you are the client, therapist, or practice, you will simply tap on the button for that area. For this tutorial, we will be the client. After tapping on the Client button, the client will be transitioned to the User ID and Password screen. Here, the client will simply use their user ID and password to sign in. For new clients, they will tap on the Sign Up button at the bottom. A client signing in for the first time will be directed to the registration screen. On this screen, the client will enter their name, email, birthday, phone number, user ID, and password. Once complete, the client will tap on the Register button to save the information and will be directed back to the user ID and password screen. Once back at the user ID and password screen, the client simply enters their new credentials and taps on the Sign In button. From there, they will be directed to the client home screen. Upon entering the client home screen, clients will be greeted with a beautiful interface that's loaded with plenty of options and features at their fingertips. Options like the menu, Tour Train, Messenger, and Profile. In addition, clients will be able to express their mood on a daily basis, and those moods will be color-coded, monitored, and added to the calendar for tracking purposes. You and your clients will be able to monitor for trends in mood on a weekly, monthly, or even yearly basis. Along with the mood tracker, clients will be offered a quote of the day for inspiration and motivation to get them through their day. Under the quote of the day, clients will find their calendar. At a glance, the calendar will show the client their scheduled appointments. The calendar will also allow them to schedule, reschedule, or cancel appointments. Let's take a look at the client menu screen. Here on the menu screen, the client has options like therapist selection, new client checklist, appointment management, session feedback, session preparation and recap, my journal, block purchase, payment information, and treatment evaluation. For this tutorial, let's choose therapist selection. The client will be greeted with the therapists that are available. If your practice is a therapist of one, then only one therapist will be listed. Practices with multiple therapists will have a scroll option so that clients can select the therapist of their choice. The client will be able to see general information, including therapist rate, mini bio, and any specialties prior to selection. After selection, the client will see the therapist booking screen. At the therapist booking screen, clients will be offered the next available appointment. From here, they can also check the therapist's calendar for other available dates. When the date is selected, they tap Book Appointment. When the appointment is made, the client will be directed to the payment screen. After payment is made, the client will be directed back to the client menu. Imagine the benefit of new or existing clients being able to schedule appointments and make payments on their own. Let's take a look at Messenger. The client can message their therapist using Messenger. The Messenger can be accessed from any screen. All messages are date and time stamped and become part of the client record. Messenger is HIPAA compliant. Now clients can stay in touch when not in session. When the Messenger is closed, clients return to the client home screen. Next, let's look at the client profile function. The client can update their profile by clicking or tapping on the profile button. From the client profile screen, clients can update and save payment information, edit personal information such as name, address, or email, choose contact preferences, choose to receive the therapist newsletter, And now this feature allows for clients to keep their contact information and personal preferences up to date. What about payment information? At the payment information screen, clients can enter their payment information one time, and it's securely encrypted for future use. Now, back to the client home screen, because there were a few things we did not cover. Just below the calendar, notice the plan of care tracker. When the client taps on this button, they can instantly track the number of sessions completed compared to their plan of care, ensuring that they have reached all their treatment goals throughout the process. This all-important feature keeps your clients engaged and on track. Next, let's look at the block payment tracker. When clients tap on the block payment tracker button, they can check the status of their block usage and make payments. For example, if a client purchased a block of 10 and they have used 2 sessions, it will reflect that there will be 8 sessions remaining. When there is only 1 session remaining, the client will be prompted to purchase another block of sessions. Lastly, the milestone tracker. The milestones button will automatically become active after every 8th visit. Other than that, the milestone button will be stayed grayed out. Clients receive alerts to check milestone measures, and the therapist will automatically receive an alert when completed. The milestone feature will keep your clients engaged in their treatment and make therapist case management timely and consistent. Now that you have taken a ride on the tour train, it's time to get back to the webinar.
MindPath will increase client retention, increase your caseload, put more money in your pocket, and make your job easier. MindPath will streamline your services, show that you care about providing the best services possible. Now that we've seen what MindPath can do to improve your client services, let's take a look at how MindPath will make your job as a therapist easier.
Yay. Anything that makes my job easier, I'm in for.
Therapists can access MindPath from a mobile device or desktop. Now, the day-to-day office work is from the desktop. The mobile device is used when they're on the go and maybe at lunch and learns or on lunch or whatever, but the menu option is the same. They've got a logo option, they've got the profile, inquiries, they've got the quote of the day, a calendar option, the caseload, alerts, messenger, and statistics. Now, the menu option, that's where you put in your logo and your profile. That area there, those are administrative features. The quote of the day, kind of like the client side, they've got the quote of the day to start off the day with inspiration and wisdom, and they're randomly generated. Inquiries, once the inquiry is entered, a therapist will get alerts to keep them on track to follow up with active engagement of those who are seeking our services.
Inquiries is so helpful as a feature in MindPath. There's no more potential clients sliding off your plate because you didn't connect on your initial follow-up. Let me tell you a little story. I called back on an inquiry that was wanting our services, and when I called back, he was almost shocked. He was like, "Oh my gosh, you're the first one that's called me. I've called like 5 other therapists over the last couple of days, and you're the first one that called me." The first one that calls and makes that connection, as in this case, he came in and we got him started on his treatment plan. So no more having lost opportunities that could cost you money. Regarding your caseload, MindPath will help you manage your caseload by providing alerts for client inactivity after 30 days. Alerts can be customized to each client, and you will also receive alerts from client milestones, so you will have the ease of checking progress checks done on clients easily and on time. Alerts that allow continuity of care and consistency so that all of your clients will receive the high standard of care that you intend to give them. MindPath makes providing the highest level of client care easier than ever before. Now, what about the calendar feature?
Yeah, let's take a look at that calendar. The calendar feature is designed to help the therapist and the client manage appointments more efficiently. No more going outside to an external calendar. No more going back and forth with the clients about scheduling. All that time adds up. Multiply that by the number of clients in your caseload. With MindPath, all the calendar information is in one place. MindPath is all inclusive. What about the alerts?
So let's talk about alerts. Alerts, on the alert button, the number of alerts that you have appears in numerical form on the alert button. You simply click on the alert and you're taken to help manage them. Messenger. Messenger makes client-therapist communication HIPAA compliant and easy. And all messages are date and time stamped and become part of the client record.
Why are statistics important to the therapist? Therapists that are goal-driven are most successful. Setting and meeting goals for patient visit average and dollar visit average will improve your bottom line. When you improve your bottom line, you increase your revenue. When you click on the statistics button, you'll have up-to-date statistical information such as the patient visit average, the dollar visit average, inquiry conversion rate, and revenue versus your projections. MindPath does that all for you. You'll have the information at your fingertips to make the best business decisions. As the Chief Financial Officer, I'm highly attuned to our business expenses, and I carefully consider the value of any new service we add. Like many of you, we use a variety of business services that require a monthly fee. Here's some examples. For instance, a secure video system costs about $85 a month. We have a payroll system that costs $70 a month. We use a bookkeeping application that's $60 a month. The retail price of MindPath is less than all of these. And right now, we're running an early kickoff program for the first 25 subscribers. These special 25 will not only get a deep discount on the monthly subscription, they also lock in their savings. Now, if that's not enough to keep you on your seat, one lucky subscriber is going to get a free 1-year subscription.
This is very exciting.
You have to stay with us to get this extraordinary introductory special. Now let's take a look at the key features MindPath has for practice management. The question is, why practice management services through MindPath are more important to you? Whether you're a practice of a therapist of 1 or you're on a team of 100, MindPath's practice management module allows you more efficient and effective management for your practice. Just like the therapist, the practice manager has the mobile device and the desktop version. Let's take a look. So you can see here's the practice management home screen. Similar to the therapist, they have the menu, the profile, quote of the day, but they also have in this order, they've got the inquiries, accounts, the calendar, and statistics. MindPath's inquiries for service tracking makes follow-ups timely to increase your caseload. MindPath will help you manage your inquiries for services. You simply enter your inquiry into MindPath. When you do that, MindPath will automatically generate follow-up alerts so that you don't miss another opportunity. Let's take a look at the accounts feature in MindPath.
Can I say something real quick about
Sure.
those alerts on
Yeah.
inquiries? These are really helpful because, again, you may not connect on that first follow-up. You might be leaving a voicemail or maybe just an email message. Having this system where you're going to be alerted to follow up in a timely manner through a little queue so that you're going to give yourself the best opportunity to secure that new patient for yourself.
Great points. How about viewing accounts? This allows the practice manager to look at all client accounts. The manager can query account payment history, see outstanding alerts, and make edits. MindPath assures collecting for your practice is easy and seamless. So when you collect payments for your services, the client enters their credit, debit, and HSA account information one time. After services are completed, you simply charge the account. Secure payments have never been easier. You'll be pleasantly surprised at the number of clients who choose this option. Approximately 70% of our clients use this feature. Clients can access their payment history saving you time. Revenue can be tracked to give you the most important information you need to grow and manage your practice. Let's take a look at how MindPath makes scheduling easier for all using the calendar feature. As I said, it's never been easier. Remember, clients have access to the therapist's calendar availability in real time. So no going back and forth with those clients trying to get appointments scheduled.
That is really important because clients, they might schedule, and then if it's not a time you're available, you've got to call them back and go back and forth. They're going to be able to know when you're available, schedule, and know that it's a done deal. You're not going to have to go back and forth trying to get your client scheduled or rescheduled.
Yeah, and the interactive calendar allows clients and therapists to see their scheduled appointments, receive appointment reminders, view therapist calendar. They can schedule, reschedule, see the scheduling history. That's all great. The next key practice management feature is the 30-day client inactivity alert. Let's look at that from the practice management side.
MindPath's 30-day client inactivity alert assures no clients drop off. MindPath will automatically alert you when a client has been inactive for 30 days. Drop-offs can be costly and do not reflect the quality of care intended. Have you ever had a client cancel an appointment and say they'll reschedule and
2 months go by,
2 months go by,
3 months go by?
well, hopefully not that long, but you know, so many reasons why this is a lose-lose situation. With MindPath, it's a win-win. Now, let's talk about how MindPath can help you with your practice statistics.
MindPath will provide you the information you need to successfully manage and grow your practice. In order to be successful, it's imperative for every therapist to know their statistics. MindPath makes it easier for you to know your statistics without having to spend hours doing all the math.
I'll be honest, if I can say right here, I'll be honest, that was one of the things that just became so overwhelming. I couldn't even, that isn't what I went to school for. I didn't go to school for numbers and keeping up with all those numbers. It was really hard. So to have a system that will take care of this automatically, you'll know at the click of a button where you stand with your statistics, I think it's a game changer.
I'm the chief financial officer, and I'd rather have MindPath help me with the patient visit average, the dollar visit average, and conversion rate to inquiries. I can also do comparisons from previous years and do project and recognize revenue.
That'll free you up to do other things that are far more important about building the business, growing the business, rather than just scribbling out, well, I know you don't just scribble out, but to scribble out those numbers, this is very important.
So what are your biggest wants? More clients? Increased revenue? Clients that stay for the full course of treatment? How about improved delivery of client services? How about more time for you? Awesome client reviews? How about more time for yourself and your family? Travel. You want to take your family on a vacation. Maybe you want to go see the country, see Europe, the Caribbean. Remember, maybe you want to support your church, their missions. Maybe you want to pay off your debt, save for retirement. What are your biggest wants? You want more money in your pocket? Better client satisfaction? To be more competitive? If you want these kind of results, then join the MindPath community.
Remember, we are sharing for the first time the exact procedures that I used to increase the efficiency of my caseload management. And like I said, this week, using the features in MindPath, I was able to go from 20 service hours a week to 30 service hours a week for the first time, and it was no sweat. Remember the math. 10 hours at $150 an hour is an extra $1,500 a week. Take that times 50 weeks, it's $75,000 more a year. In 5 years, it's $375,000 more.
That's a lot of extra money.
That is a lot of extra money. Or if you were more interested in more time, you can enjoy your time more and just have a little more money, or a lot more money still. Again, what would you do with the extra money? Remember your wants? This is important. If you stay with us and get on the list now, because the list is reserved for the first 25 subscribers only. This is what you get. With MindPath, you get a patient partner for your practice, a complete mobile-friendly application with over 50 screens, an app that is compatible with all mobile devices, including iPhone, Android, as well as desktop. With MindPath, you get digital video demo tutorial, promotional materials for your clients, and a promotional email campaign to introduce MindPath to your existing clients. With MindPath, you get printed colored promotional materials to hand out to your clients, 5 bonuses, and responsive customer service support so that every step of the way will be there, all at a very low price.
So let's recap. You get the client home screen, you get the menu option, the tour train. Remember the tour train? We saw that demo. The messenger. You get the client profile, quote of the day, the mood tracker, the plan of care tracker, block payment tracker, and the milestones. Why are client services through MindPath more important to you? Remember, it's to keep clients for their full course of treatment, to provide better case management through automatic progress checks, and to provide session feedback to help make adjustments early to best meet clients' needs. Also, knowing the client's state of mind before they even show up for session with that mood tracker and that HIPAA-compliant messaging. Remember, therapists can access MindPath from a mobile device or the desktop. They can do their day-to-day office work from their desktop. When they're on the go, they use their mobile device, maybe at lunch and learns, things of that nature. They have the menu, your logo, they've got the profile, they've got inquiries, quote of the day, caseload, remember calendar, alerts, messenger, and the statistics button. Why therapist services through MindPath are important to you? Inquiries. No more lost opportunities that cost you money. Your caseload area. You're going to be alerted when important case management activity needs to be performed.
This is so critical because it's going to make your job so much easier to have those alerts coming to help best manage your caseload and provide the quality care you intend.
And the calendar option. Remember, that calendar saves you valuable time managing your schedule. Messenger. Don't forget, Messenger on every screen. That option makes client-therapist communication HIPAA compliant and easy. All messages are date and time stamped, and they become part of the chart record. The statistics area, when you click on the statistics button, you will have up-to-date statistical information such as that patient visit average, dollar visit average, inquiry to conversion rate, and the revenue versus the projections for that. MindPath does it all for you.
Yay.
You have all the information at your fingertips to make the best decisions that you need to make. So let's not forget about practice management. That area is important as well. The practice management home screen, similar to the therapist screen, they've got the menu, the profile, quote of the day. They also have inquiries, but they've got the accounts. Then they've got calendar and statistics as well. Remember why that's important. MindPath assures collecting for your services is easy and seamless. Scheduling's never been easier for the clients and the therapists. MindPath's 30-day inactivity ensures no clients drop off. That's important.
Yeah.
That's huge, the drop off. MindPath's inquiries tracking makes timely follow-up to increase your caseload. The statistics MindPath will provide you with the information you need to successfully manage and grow your practice. So what about the early kickoff program?
Okay, let's talk about the early kickoff program.
Let's get into that.
So the early kickoff program, this is a pre-sale. It's kind of like when you buy into a new community and the utilities are in, the roads are all paved, the streetlights are on, and you're standing in the model home. And you will get a very special deal for being part of the first wave to buy in. When the wave goes past, so does the discount. What is the discount? The retail price of MindPath is $59.95 a month. And you haven't even seen all the features yet. Right now, we are offering early entry into MindPath for $49.95 a month. If your practice is doing $50,000 a year, with MindPath you could be doing $65,000 a year. That's a 30% increase we've been talking about. $15,000 more a year just for making the decision to use MindPath. And it will be easier to deliver your services and make more money. Now, because we are so excited to get MindPath out for the first time, we are giving this very special group of the first 25 subscribers the pre-launch price of
$39.95.
$39.95. That's a $20 discount off of retail.
That's huge. Remember, this application comes with an external promotional demo video to attract new clients. It has an internal step-by-step tutorial for that tour training. You saw that. Your clients use this once they download the mobile app the first time, and then they're prompted to use it, and then they can use it anytime they want. This combination is sure to make your practice to go from where it is now to the next level. All right, we've got 3 important announcements. Because this is the early kickoff program, we can only take the first 25 subscribers. Once the early kickoff program's over, MindPath will never be offered at this special rate ever again. You will save $240 in your first year by signing up today. So right now, I'm opening up this to the first 25 who subscribe. Click on the buy button now.
You can have all the prestige and success that goes along with delivering your services with a mobile-friendly application. You can have all the competitive edge that goes along with delivering your services using a mobile-friendly application. How would your life change if you were using MindPath? Remember your wants? What are your biggest wants? More clients? Increased revenue? Clients that stay for the full course of treatment? Improved delivery of client services? More time for yourself? And how about those great reviews you're going to get on Health Grades and Google?
Yeah.
How about more time for yourself and your family? To travel, to take your family on a vacation, see the country, go to Hawaii, the Caribbean, maybe even to Europe. Maybe you want to support your church or their church missions, paying off debt, or saving for retirement.
Yeah.
What are your biggest wants? More money in your pocket? Better client satisfaction? To be more competitive? If you want these results, then join the MindPath community today. Remember the math. 10 hours at the $150 an hour is $1,500 extra a week. Take that $1,500 times the 50 weeks, that's $75,000 a year. Over 5 years, it is over $375,000 more to you.
That's a lot of extra money.
That is a lot of extra money.
It's huge.
Yeah. And like I said, if you want to take more time off, if you want to take a month off in the mix of things, you're still going to have more money. More money and more time. That's what MindPath delivers.
So think about how much easier managing your private practice will be with MindPath.
And it will. It'll be so much easier.
Think about the savings you'll receive from the early kickoff program. This has never been offered before today.
Big savings. And,
Right.
it won't be offered again.
No, it won't. So we've got some bonuses for you. Bonus number 1. We have a promotional video for you to use on Facebook, Instagram, and Twitter for your new clients.
This is going to be prepackaged so that you can just put it out there and promote yourself on Facebook with a nice ad.
That's huge. Bonus number 2, color promotional materials.
Yes, we're going to provide you with the color promotional materials so that you can introduce clients to your existing clients to MindPath, and also to hand out when you're out in the community to attract more clients to you because you're using MindPath.
Little grassroots. Bonus number 3, promotional video to help existing clients migrate over to MindPath, and an email campaign through MailChimp.
Yeah, so both of these, again, are going to be nice short 30-second to 1 minute video clips that you'll be able to help your clients migrate over to MindPath, as well as through MailChimp. If you're using a newsletter, you can stay in contact and introduce this great new engaging MindPath to help your clients get more out of the treatment that you're providing.
Very helpful bonus.
Now, those are the first 3 bonuses. The big bonuses are coming. Are you ready? These are worth a year's cost of the app. Now, the early kickoff program pricing, like we said, is $39.95 a month, and this is a one-time only offer. Your exclusive rate will be locked in. Are you ready for this?
I'm ready.
Okay. This $39.95 a month rate will be locked in for the first 25 who join now for the lifetime of your membership.
That's awesome.
I know.
That's an awesome bonus.
Well, we appreciate you guys listening, and so this is our way of giving back to you. You'll be able to secure that $39.95 rate for the lifetime of your membership. And bonus number 5. One of you lucky 25 are going to get a lifetime subscription to MindPath. So if you haven't signed up, you want to sign up now. This is just for the first 25. That one of you will get a full lifetime subscription to MindPath.
Free.
Yeah, we're so excited. We're really excited about helping you help your clients and helping your job be made easier so that you can truly have more time to do the things that you want to do in your life and more money because you deserve it.
So if you haven't signed up, sign up now. What about our personal guarantee, Lynn?
Okay, so our personal guarantee to you is that if MindPath isn't everything you thought it would be, and if at any time you think MindPath wasn't worth twice the money, that you can cancel anytime, no questions asked. We have used the features of this app hundreds of times. It works. You are handicapped without it. Why would you risk the success of your practice? If you're going to take advantage of this one-time opportunity, you must do so now. There's a reason why you stay tuned to the end of this webinar. Click on the Buy Now button.
Where will you be a year from now? This simple step can change your life. Where will you be 5 years from now? It's decision time. Let me give you a 20-second recap. With MindPath, you get a complete user-friendly mobile application with over 50 screens. You get an app that's compatible with all mobile devices, including iPhone, Android, tablet, as well as desktops. You get a digital video demo tutorial, promotional materials from your clients. You get a promotional email campaign to introduce your MindPath to your clients.
Boy, this is a lot.
It is.
It's a lot.
Yeah, it's a lot to say.
It's a lot to say. It's a lot to give.
You get printed color materials to hand out to your existing clients. You get the 5 bonuses. You get responsive customer service to help you in your support every step of the way, all at a very low cost. Remember, over 50 screens of MindPath, client services area, the therapist module, practice management.
Remember those statistics. They're going to be done easily for you. You're going to have them at your fingertips. You're going to love it. There's no annual fee if you get in right now. No long-term contract. Truly, there is no risk and no obligation. Here's what you do. Just click on the Buy Now button. So, time's about up. When the webinar is done, it's over. This special pricing, will not be offered ever again. And there's a reason you came to this webinar. You need MindPath, and you can't get it anywhere else. Others are jumping in today. Why not you?
We've got some questions and answers we've got some answers to questions that have come in.
We've had some questions come in.
Yeah, we have. And one here is great. The first one right out of the gate is, what is the difference between MindPath and therapy notes?
That's a very good question.
Well, let me delineate that for you. MindPath is really heavy on the client side, where it's designed to engage the client with the therapist to keep them on for their plan of care. Remember the plan of care? Well, we want to keep them to the end. Therapy notes is a little more centered for the therapist, and insurance and billing. So there's the differences. Another question, is MindPath hard to use?
MindPath is so easy to use. It's intuitive. If you can use the internet, you can use MindPath.
Here's another one. How soon do we get the bonus materials? Lynn, I'll leave that up to you.
You get the bonus materials right away.
Will this be offered later? Not at this rock bottom price, okay? MindPath will be offered later, but not at this price.
So here's one. I'm already in practice. Will it help me? Absolutely. MindPath will engage all of your clients more consistently in your therapy, in your services, so that they will stay longer, they'll get better service from you. Thank you so much for attending the webinar. The webinar is ending. If you are going to join, you must do it now. Order now and get all the bonuses. So the webinar is now over.
Thank you.
If you are filling out the registration for MindPath, you will be able to finish after we close the webinar. We'd like to thank you so much. We wish you so much success in your practice. And remember, the work is great, but the workers are few. What you do matters. You matter. Thank you for your time.